Next, I'm going to assess your ears and your hearing. I'm just first going to kind of tug on your ears. Is there any tenderness when I do that?
No.
Other than your piercing over there. Okay, and your auricles are equal to the top of your eyes, symmetrical. The skin around your ears is normal for your color. Next, I'm going to just look inside your ear. If I had an otoscope, I would be able to see, but I would be looking in for the any cerumen, any drainage, any swelling, for the cone of light. I'd look in both ears for that. Next, I'm going to whisper 3 words, and I want you to repeat them back to me.
Sock, blue, bed.
Perfect. So then I'm going to take my tuning fork, and I'm going to place this on the top of your head after I hit it, and I want you to tell me if you can hear the sound equally in both ears. So just place that there. You hear it equally?
Yep.
Okay, perfect. And then I'm going to do the same thing. I'm going to hit it, place it behind your ear. I want you to tell me when you hear the noise stop. Then I'll turn it here, and I want you to tell me again when the noise stops.
Yep. Yep.
Perfect. So it's about a 2-to-1 ratio from the air conduction to bone conduction, and that's perfectly normal. Next, again, if I had an otoscope, it would be easier. I'd look up your nose, so just tip your head back. I'm just peeking. I can see some fine villous hair. I don't see any excessive draining. The skin is pink, moist. I look for a deviated septum, which I wouldn't see. And be able to see the lower turbinates, which are a darker pink in color. No excessive draining. Next, I'm going to palpate your sinuses. You tell me if there's any tenderness when I palpate. So your frontal, any tenderness?
Nope.
And then your maxillary sinuses.
Nope.
No tenderness there, perfect. Next, I'm going to look at your lips. Let me just see they're pink, they're dry, there's no scabs or open areas, no bleeding. I'm going to look inside your mouth. Your gums are pink and moist. I'm looking up at your hard palate and your soft palate. Just gulp down, swallow. No, with your mouth open. Okay, and it has good range of motion. Looking at your tongue, there's no lesions on your tongue. There's no drainage, no cuts, anything like that. I want you to just stick your tongue out for me. Good, that's tapping your cranial nerve. For tongue protrusion, it's symmetrical. One more time open for me. I'm going to look at your uvula. It's midline, and normal in size. Pink and moist. Next, I'm just going to palpate your neck. Any tenderness there at all?
No.
Fine. I'm going to palpate some nodes. I'm going to palpate, this is your tragus. I shouldn't be able to feel them, but if you feel any tenderness, you tell me.
No.
Okay, so that's your preauricle, your posterior auricle, your tonsillar, submandibular, and submental. Any tenderness when I'm palpating there? Perfect. And then the anterior superficial cervical chain, the posterior superficial cervical chain, and then the deep superficial cervical chain. Any tenderness there?
No.
And then the supraclavicular above your clavicle, and then below your clavicle. Any tenderness there?
No.
Okay, and I'm not able to palpate any of those nodes, so that's good. I keep it not enlarged. I'm just going to have you kind of tip your head. I'm going to palpate your trachea. Do me a favor and swallow for me. Good, move symmetrically. Okay, this midline. And then I'm just going to turn the chair here. I'm going to reach around you and palpate for your thyroid. Okay. So I can feel it right there. Again, give me a good swallow. Okay, movement is equal. So then I'm going to have you tip your head down and back all the way to the side, the other side, and then down towards your chin, your neck, other way. Okay, I'm going to put my hand here. Push against my hand. Perfect. Push against my hand. One more time. And push. Perfect. That's good range of motion. +5 strength.